ever worry about the long-term impacts of COVID? I mean, we all know about the initial risks, but what about complications that could linger after you get over the initial infection?
Yeah, it's a question a lot of people are asking, and thankfully research is catching up.
That's what this deep dive is all about. You sent us some interesting research on COVID vaccination and its impact on something called cardiac and thromboembolic complications. And I
Yeah,
know that sounds like a mouthful.
it does, but it's really just a fancy way of saying serious heart and circulatory issues like blood clots, heart failure, those sorts of things, which can obviously have a huge impact on someone's health long term.
Right. We're not just talking about a few sniffles here. These are serious conditions.
Yeah.
So tell me more about this research. Why is this particular study so important?
Well, I think first off, just the size of it is really impressive. We're talking about data from over 20 million people across 3 different countries, the UK, Spain, and Estonia. So this wasn't a small, isolated study. It gives us a really broad, comprehensive look at these long-term effects.
Okay, so big study, big implications. What did they find?
So this research found that people who got vaccinated against COVID-19 were significantly less likely to develop these cardiac and thromboembolic complications after being infected compared to those who weren't vaccinated.
So vaccination acting as a shield even if you do end up catching the virus.
Yeah, precisely. And what's really interesting is that this protection wasn't just in the short term. They tracked people for a full year after infection, and the vaccinated group consistently showed a lower risk of developing these complications, even months down the line.
That's incredible. Can you give us some concrete examples?
Sure. For example, the study found that vaccinated people were 78% less likely to experience something called venous thromboembolism within a month of getting COVID.
Venous thrombo.
Yeah. Sorry. Yeah, it's a mouthful, right? It basically means blood clots, often forming in the legs.
Oh, wow. 78% is a huge reduction. So it really drives home the point that vaccination isn't just about avoiding those initial COVID symptoms.
Right. And I think that's really important. It's about protecting your health in the long run. And I think this study provides really compelling evidence that it does just that. You see, a lot of the early focus was on vaccines preventing severe illness and death from COVID, which they do incredibly well. But, this research really highlights that the benefits extend far beyond just that initial period and could potentially impact your health for years to come. I think that's a real game changer in how we view the role of vaccination in this whole fight against COVID long term.
This is all so fascinating. I have to ask, how did they actually conduct a study with this many people?
So they used a really clever approach called a staggered cohort study design.
Yeah.
And essentially they mirrored how vaccines were rolled out, right, in phases in each country. So they created these mini studies for each priority group and then combined the results. Think of it like taking 4 snapshots at different points in time, which gives you a much clearer picture of the long-term impacts.
That's a really intuitive way to explain it. So they were very mindful about making sure they were comparing similar groups of people.
Exactly, yeah. And to add another layer of precision, they used some pretty sophisticated statistical tools to make sure there wasn't any bias in the results. One of them is called propensity score weighting.
Okay, I'm going to stop you right there. Propensity score weighting. Can we get that in plain English?
Of course. So imagine you're trying to compare 2 groups of people, but they come from slightly different backgrounds, have different health histories.
Right.
This statistical method helps make sure you're comparing apples to apples, so to speak, by taking those differences into account.
That makes a lot more sense.
Yeah.
So they went the extra mile to make sure these results were as accurate as possible.
Precisely. They wanted to be confident in their findings. And I think, this really meticulous approach really strengthens the reliability of this research.
Yeah.
It really highlights the importance of taking that long view when it comes to COVID and vaccination. We're really just starting to uncover these long-term impacts.
It makes you think about all the different things people weigh when they're making decisions about their health. It's not always just about the immediate risks.
Right. Absolutely. And this research, I think, really underscores the importance of considering those potential long-term consequences of infection, which can be, as we've seen, significant.
This is probably a question on everyone's mind. What does this research tell us about long COVID? I mean, this study wasn't really looking at that specifically, was it?
Right. They weren't specifically looking at long COVID for this study, but I think it raises some really interesting questions. If vaccination can offer this level of protection against these serious cardiovascular complications, it makes you wonder, could it also reduce the risk of developing those long-term, often debilitating symptoms that are associated with long COVID? So, I think it's a natural next step in the research, and I wouldn't be surprised if researchers are already exploring that connection.
Yeah, it's like this ripple effect, right? One discovery kind of leads to a whole new bunch of questions and potential breakthroughs.
Yeah.
It makes you wonder, what other long-term impacts are we just starting to even understand?
Exactly. We're in uncharted territory in a lot of ways, and I think this research just really highlights how much more there is to learn about how COVID, vaccination, and our long-term health all kind of interact.
Mhm.
It's definitely a complex puzzle, and studies like this are so crucial in helping us kind of piece it all together.
This whole conversation got me thinking. The study covered 3 different countries in Europe, right? Did they find any differences in the results between those locations?
It's interesting, the trends were really consistent across the UK, Spain, and Estonia.
So no matter where people were, vaccinated individuals were just less likely to have these complications.
Yeah, exactly. And I think that consistency across those different populations really strengthens the findings. It suggests that the protective effect of vaccination isn't necessarily limited by, you know, geographic boundaries or specific things about different groups of people. This is truly a global issue. And the solutions, it seems, might be just as universal.
Yeah, it makes you appreciate how collaborative science really is.
Yeah.
Researchers all over the world are trying to put this puzzle together one study at a time.
Yeah, it's amazing. It's a testament to what we can achieve when we work together.
Mm.
And this study in particular, I think, sends a really powerful message about the long-term benefits of vaccination.
It really does make you stop and think. And I imagine these findings have pretty huge implications, not just for individuals, but for healthcare systems as a whole, don't they?
Oh, absolutely. If we can reduce how often these long-term complications happen through vaccination, that could really lighten the load on healthcare systems down the line.
That's a really important point. It's not just about individual health, it's about the health of our communities and making sure we have the resources to support everyone.
Precisely. This research gives us really valuable data that can help shape public health policies and strategies going forward. And speaking of different vaccines, we mentioned earlier that this study looked at two specific COVID vaccines, right? The Pfizer and the AstraZeneca.
Yeah, that's right. The study focused on the Pfizer and the AstraZeneca vaccines. So did they find any difference in the level of protection offered by those two vaccines, specifically against these long-term complications?
They did. When they looked closely at the data, they found that the Pfizer vaccine was linked to a greater reduction in the risk of venous thromboembolism, those blood clots, particularly in the legs that we talked about, in the acute phase, so right after infection, compared to AstraZeneca.
Interesting. So some subtle differences in how these vaccines are impacting our system, but both offering, really substantial protection overall.
Exactly. And I think that's a really important point to emphasize. This research really does underscore how effective vaccination is in general at reducing those long-term risks of COVID, regardless of which vaccine a person received.
This deep dive has been really eye-opening. Before we wrap up, are there any important caveats about this research that we should keep in mind?
That's a great question. It's important to remember this was an observational study, right? So they were working with existing health records. And while those are incredibly valuable, this type of study can't totally rule out other factors that might be playing a role.
That's fair. It's all about looking at the big picture and, considering all the evidence.
Exactly. And I think in this case, the fact that the study was so large, combined with how carefully they designed it, makes these findings really quite powerful.
It's been great taking this deep dive with you. Any final thoughts for our listeners as they process all this?
I'd encourage everyone to see this research as just one piece of what we know about COVID. It's a reminder that this virus is complex, its effects can last a long time. But I think just as important, it also highlights just how powerful scientific research is and all the progress we're making in understanding and hopefully overcoming this virus.
Great advice. Stay curious, everyone, and thanks for joining us on this deep dive.